Welcome back today to the Maryland World Health Association's podcast, The Voice of World Health. We welcome you back, and we have two special guests on with us today, Jen.Thomas and Isabel.Rodriguez from WellSky. And I'm sure you're probably wondering what WellSky is. So I'm going to turn it over quickly, though, for introductions, if Jen would like to introduce herself first.
Sure, happy to. Thank you so much, Jonathan. Happy to be here today. So I'm a lifelong Marylander, born and raised on the Eastern Shore in Queen Anne's County. And I moved west to attend Frostburg State University and made Allegheny County my home for about 25 years and now reside far west in Garrett County. So after graduating from college, I devoted my career to nonprofit work. I've always been drawn to helping others, especially surrounding their health and well-being. I spent many years in the public school system, focusing on after-school programming. I worked under a variety of grants and spent about 10 years with AHEC West in Allegheny County, and I worked on oral health disparities around access to care, developed an opioid misuse prevention program for women, and then I also served as the coordinator for the high school healthcare pipeline program. Eventually, I moved on to work in the hospital setting at the community level at UPMC Western Maryland. I started there as a health educator where I really focused on obesity issues. And eventually, I moved on to become the manager of community health and wellness. I spent time as the Local Health Improvement Coalition co-chair and worked on community health needs assessment reporting and developed programs and services to really just improve the health of the community. And a side note, I'm personally passionate about health and wellness, and I'm a certified personal trainer, fitness instructor, and health coach. But to bring you to my current role with WellSky, I serve as the Maryland Network Director of Relationships, in which I work on addressing social care coordination. So I work very closely with our client, Maryland Physicians Care, and we take a partnered strategic approach towards building a really strong network of community-based organizations that can provide a variety of social resources that they can help their Medicaid members, which we will be talking about today.
Great. Thank you, Jen. Isabel.
Thanks, Jonathan. Thank you for having us. So my background, similar to Jen, is in community health. I have an undergrad degree in community health education and a graduate Master of Public Health degree with a concentration in urban and immigrant health. I'm also a certified health education specialist. I've worked for almost 20 years in a variety of nonprofit settings, community-based organizations, academic medical centers, hospitals, even a health information exchange, and as a congressional fellow, which is actually what brought me to the DMV area. I am a native New Yorker, but I'm happy to call Prince George's County home for the past 2 years. And all of my work experience has really been focused on advocating for and connecting people to the social and medical services that they need, with a focus on those who do not have the same access as others. So I'm really excited to work on this project, helping the residents of now my home state. And I saw this opportunity with WellSky as a way to bring community-based organizations together via technology with a purpose. And I serve as the statewide manager of network relationships, supporting Jen's role and our community-based organizations. Coming from this long career of working with nonprofit CBOs, I understand the struggles that they face in connecting with the people that need them the most. And these are, things like limited funding, staffing, and infrastructure. So I work with helping their teams understand this platform that we're going to talk about, how to use it, and providing any support that they may need. But as you can imagine, being part of a small but mighty team of two covering the entire state of Maryland, Jen and I both do a bit of everything. So thanks again for having us.
Absolutely. Well, it's nice to meet you both here on the podcast and have you as guests. And you touched on WellSky a little bit what it is, but I'm sure our listeners are very curious to hear a little bit more about that. So can you tell me exactly what is WellSky, Jen?
Sure. WellSky is a technology company really leading the movement for intelligent, coordinated care, not just in the United States, but worldwide. So we offer software analytics and services to power better outcomes and lower costs for stakeholders across the health and community care continuum. And, as you know, in today's value-based care environment, WellSky can help providers, payers, health systems, and community organizations all come together to work together to solve really tough challenges, improve and enhance collaboration for growth, all while we're harnessing the power of data analytics to achieve better health outcomes. Addressing social determinants of health at an individual and even population level is essential to improving health and reducing health disparities. And we'll be sharing some data in a bit to showcase that need. And as the social determinants of health have become better understood, it's become clearer that healthcare problems truly cannot be solved through healthcare systems alone. So addressing those challenges requires smarter solutions that achieve lasting outcomes. And we really feel that no one's health should be hindered by need. And that's really what WellSky Social Care Coordination is all about.
Awesome. Thank you. That's very interesting. And you kind of alluded to SDOH, or social determinants of health. And obviously, the state has been really pushing initiatives around social determinants of health. So could you maybe expand on that, Isabel? What are SDOH and why they're very important, and especially how that relates to the rural areas across the state of Maryland?
Absolutely. So, social determinants of health, or SDOH, as you said for short, are, according to the Centers for Disease Control and Prevention, the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect the wide range of health, functioning, and quality of life outcomes and risks. And around 40% of that, of our health, right, is impacted by these social determinants of health. And these include things like access to food, not just any food, obviously healthy foods, education, job status, our family and social supports, and so on. But another 10% of our health is accounted for by our physical environment, where we actually live. And then you factor in another 20% for our health behaviors, those things like our tobacco or alcohol use and our diet and exercise. So, I'm not a mathematician, but that leaves only about 20% of our health outcomes to the healthcare that we actually receive. So the medical and dental services, if you will. And residents of rural areas face an extra layer of challenge because all of these things that will support their health may be scarce or non-existent in their communities. And if they are, they may be very far away from their homes. And we know addressing social determinants of health, like Jen mentioned, at both the individual and population level is essential to improving health and reducing those health disparities. So, things like health studies that we have read about and seen, they've shown that children of adults who don't earn a high school diploma, for example, are more likely to grow up in areas with barriers to health. And then for those that are living in poverty, there is a direct correlation to a shorter lifespan. But we can't speak about social determinants of health without mentioning health equity. And health equity means that everyone has a fair and just opportunity to be as healthy as possible. And this requires removing obstacles to health, such as poverty, discrimination, and their consequences, things like powerlessness and lack of access to good jobs with fair pay, or quality education and housing, or your safe environments and healthcare at the tail end. But health equity is not to be confused with equality, and a lot of folks sometimes mix the two up. There's an image, if anyone Googles, they can find a health equity image of 3 individuals. It really captures this difference between equity and equality really well. 3 individuals of 3 different heights standing at a fence. It's at like a ballpark game or a stadium of some sort. And one individual is tall enough that they can see over the fence. The other one can see over the fence if standing on one crate. And the last one is just too short, even with one crate, to see over that fence. So when we think of equality, it would be giving everyone the same, right? So that one crate to everyone. But equity is really giving the number of crates necessary to bring people to the same level. So the shortest person would get 2 crates, the medium height, if you would get 1 crate, and the tall person that didn't need it in the first place would get none. So this network that Maryland Physicians Care is sponsoring really works at removing obstacles by connecting people to the needs outside of the healthcare services that they as a Medicaid plan cover. And the goal of the work that Jen and I are doing is to help build this network out so that we can connect people in these communities and sometimes the services they don't even know exist. So our work in a way has a twofold impact. We are helping MPC connect their members to services, and then we're also increasing awareness of the services in the community. And we've heard repeatedly from our CBOs that a lot of clients come their way because of word of mouth. So that's an important way to spread the word about their services.
Great. Thank you, Isabel, for that really great thought out answer to talking about the social determinants of health. And I know that you had also mentioned there a little bit about rural communities and their different needs. And you said that they're far away. And I think folks that listen might not realize that, living in rural Maryland, obviously 18 of the 24 jurisdictions in Maryland are considered rural, that transportation and access to care, there are lots of different barriers to folks living in those communities where specialized care and even just primary care can be 30, 40, 50, even an hour away in some instances. And you touched a little bit on the partnership there with Maryland Physicians Care. Jen, is there anything else you would like to add about that work in Maryland in the social care coordination?
Yeah, I would love to. So, yeah, Maryland Physicians Care is our great partner. And just for your listeners, they are the third largest managed care organization, or MCO, in the state, with just around 250,000 Medicaid members. And they're a for-profit nonprofit, if that makes sense, because any profit they do make goes back to the community. So Maryland Physicians Care created a social determinant of health, or SDOH, team over a year ago now, led by their senior director of population health. They have since divided Maryland into 5 regions for this scope of this work. So region 4 is Western Maryland. So we're talking about Garrett, Allegheny, Washington, and Frederick. Region 1 is Baltimore City. Region 2 is Central Maryland. That's Anne Arundel, Carroll, Baltimore, Harford, and Howard. Region 3 is the metro area, Montgomery and PG, and then Region 5 are all of our upper and lower Eastern Shore and Southern Maryland counties. Isabel and I began the work with MPC in Region 4 in Western Maryland and Baltimore City, Region 1, because that is where the highest percentage of MPC members reside. So Maryland Physicians Care have been establishing a social worker, and at least one, if not more, community health workers in each region. And their main role is to screen their Medicaid members for social needs, whether it's food, housing, employment, education, and so on, assigning them a risk score, which helps prioritize those individuals with the highest need, meaning multiple services. They conduct the screening all within the platform, and then they're able to refer the members directly to the CBOs who can provide those services and get the members the help they so desperately need. So in a nutshell, MPC contracted with WellSky so they could focus on SDOH needs for their member population, knowing this is going to have the greatest impact on their health outcomes. So WellSky powers the software, which provides MPC with the mechanism to easily refer their members to social care resources in the communities in which they live. And our focus, the real work, is what we're trying to build is an accountable network of CBOs throughout the state, region by region, county by county, even narrowing down by high-risk zip code areas. So the CBOs that join the accountable network agree to receive direct referrals from Maryland Physician Care and acknowledge that they will address each one by connecting with the member and either 1, providing the service, or 2, canceling the referral for whatever reason, making note as to the reason why. This allows us to close the loop, knowing the member received the service, and then we can capture all kinds of great data benefiting both MPC and the CBO. There's no cost for CBOs to receive the referral, so some of the benefits to them by joining are free usage of the platform for real-time referrals. So this is eliminating the need to call, email, fax, trying to track down those referrals and keep up with them. It increases network opportunities with other CBOs and clinical providers. And then finally, they get monthly data reports, which help paint the picture of community need and then can also assist with future funding requests.
Wow, that's a lot, Jen. Thank you so much. I think that it's a lot of information to take in. And obviously, it sounds like you're doing really good work. And community partners, obviously, there's a lot of benefit. And I really like to hear, I hear closed loop referrals. I also hear, follow-up and data collection. I think that's all really important when we look at technology and healthcare and our social determinants of health. So I really appreciate your very robust overview there and your partnership with MPC. Now, Isabel, can you tell me what resources you see kind of the most referrals happening in a community or taking place with your platform?
Absolutely. And Jen mentioned that MPC broke down the state into regions, and we actually started with Region 4, which is, considered rural. As you mentioned, most of the counties in the state are. But the data that we are seeing around these referrals really shows the highest needs being around food, social supports, housing, and employment. But we're also seeing transportation as a huge need for our rural communities in particular. And we see many communities working to address this need in particular, but often the resources are limited. And it's not a one-size-fits-all approach considering the differences in the counties across our state. No one has really figured it out where we could take that as a sample and just copy and paste across all counties. And these needs are really reflective of what a lot of the country is experiencing since COVID-19, the massive loss of life, employment, opportunities, and services in the community. Some directly because of COVID-19, shutting their doors, and others because the emergency funding that was supporting their work has now ended. But some communities, again, especially rural ones, have had a harder time bouncing back from those 1-2 punches that the pandemic hit us with.
Absolutely. And I think that, this is the solutions that you're implementing to solve, obviously, those challenges are across the country, obviously here in Maryland, and we keep bringing back transportation as being a huge barrier. And obviously, I think that transportation is a very large barrier for a lot of rural communities and individuals. Public transit, as we know, isn't readily available in certain counties across Maryland, and folks living much further away from doctors' offices obviously present a lot of different challenges. Now, if you're a community-based organization and you want to get involved in this network, what are the next steps that they need to take to get involved? And obviously, Jen, would you like to kind of highlight that?
Sure. So, each day we're working on researching community-based organizations, outreaching to them, and making those connections and building relationships, hopefully to foster lasting and impactful partnerships with this work. So if CBO expresses interest in partnering, our next step is to set up an introduction meeting and review the work kind of as we are, today that we're doing in Maryland, and talk about the importance and urgency of need. So we listen also and learn a lot about the services that the CBOs provide, and talk about their current workflows for receiving referrals, and then review the various ways to participate in the network. So the first meeting is really a two-way discussion of how we can best work together, and then where they may fit within the network. And Isabel, you can add on to the second part of that.
Yeah, thanks, Jen. As Jen mentioned, once they've shown interest, we give them a demo of our platform and we show them how it would work, again, walking through their specific services and workflows, and really determining if it's a good fit for them or how they would fit within the network. And it's really a simple web-based platform that anyone can learn to use. There's no software to download. It's just a web page that you would bookmark. And we usually do this training in a 30-minute time frame, but we hold your hand along the way. If you need some additional support to grasp any of the concepts, we are there for you all the way. But we work to capture all the information of their services and programs, like Jen mentioned, as we collect in that first introductory meeting, and we create resource pages for them that live within this platform and allows MPC staff to review and appropriately refer their members for those services. And the last step is to get all the CBO staff that are going to use it trained, and then we flip the switch, so to speak, so that the organization can begin accepting referrals. And we can move as fast, as at the speed of need, as we say, or at the speed of the CBO. The process can take as little as 1 week if we can schedule everything and the stars align, as I like to say.
Wonderful. And that sounds fantastic. And for our community-based organizations, I think that how would they get in touch with you? How would they contact you to start this process?
Yeah, I think that really the easiest and quickest way to get a hold of us is our email. So I'll share mine first. Is Jen Jen.Thomas. So it's Jen, Jen.Thomas, THOMAS at WellSky.com.
And for me, they could reach me at Isabel.Rodriguez. Mine is going to be a little bit longer, but that's ISABEL.RODRIGUEZ at WellSky, which is WELLSKY.com.
Wonderful. Well, thank you both for giving us really robust overview and a great conversation today about what WellSky is and how our community-based organizations, as well as other organizations across the state, can take advantage of the resources and technology that you have to offer. We'll make sure that we put your email in the description of the podcast so folks don't have to listen to it if they don't have something to write it down with, but they can kind of copy and paste it and get a hold of you in that way. Is there anything else that you would like to add before we close out?
I don't think so. I'd just like to thank you again for the opportunity, Jonathan.
Yes, thank you. And we're really looking forward to connecting more people to the services. Our CBOs are really the backbone of our communities, and we really appreciate that work that they are doing and hope to connect as many people in those communities to them as possible to keep them as healthy as can be. And we're hoping for a healthy 2024 and beyond for all. Thanks again.
Wonderful. Well, thank you so much, and tune in to the next episode of the Maryland Rural Health Association's podcast. Thank you.